Hello, everybody. Today we're going to talk about treatment planning, and if you've not seen the one on Psychiatry interview, do that one first. And that one is about 12 minutes. I apologize. Treatment planning in psychiatry is best organized by the word biopsychosocial. Now, I know that word seeks to mean everything and therefore ends up meaning nothing. But the clear value of it is that it seeks to mean everything. So it covers the waterfront in terms of treatment planning. So bio, think what pills this person should be getting, what medications. Always, always, always give them the pills that worked. If none of the pills worked, don't give them those. Try a new one. So bio, what pills? Next, what lab tests they should get. Now, if somebody is on an antipsychotic, for example, they should always get hemoglobin A1C and lipid profile, but you should also do medication checks on other things that may be causing problems. For example, their sugar, if they are clearly on diabetes medicines, or other labs for other medical illnesses they have. So what pills, what lab tests, and then who would you consult? And that usually has to do with other disorders. If somebody has trouble getting around, consult to physical therapy is helpful. Somebody who comes in with a chief complaint of their sugar is way too high, internal medicine consult would be helpful. So anyhow, that would be the way of doing the consults. What do you need? Sometimes you don't need a consult. So bio, what pills would you give? What lab tests would you do? Who would you consult? Psycho is next. And psycho means what sort of psychotherapy you would do. Know that for medical students, the test question answer is always CBT, cognitive behavioral therapy. And that is the answer for depression and anxiety disorders. If somebody has borderline personality disorder, it's DBT, or dialectical behavior therapy. If somebody has a substance use disorder, it is motivational interviewing. Now, motivational interviewing is not, come on, you can do it. Motivational interviewing is what is their motivation for doing something. And the quick way of doing that, say, what do you get out of this? What trouble does it give you? And that will give you an idea. Look at psychotherapy, one of these later on, that will give you a better idea. Psycho then means what psychotherapy you will do. Social means what should a social worker do for you, for this patient. And it's always housing and benefits and insurance coverage. So you know that a good chunk of your patients on the inpatient unit are there because of social reasons. So that is always a very important reason. So social means what kinds of social needs do they have, which is always housing and benefits. For many people, that will be the most important. For outpatients, psychotherapy is often more important. For inpatients, the biological parts of things are important. So treatment planning, think bio, psycho, social. Bio, what pills would you give? What lab tests do you need to do? What x-rays? Do they need a CT scan or MRI? Who would you consult? Psycho, what sort of psychotherapy? CBT, DBT, or motivational interviewing. Then social, what a good social worker should do for you, which is always housing and benefits. And that's treatment planning in psychiatry. And thank you for your time. And again, if you haven't seen the psychiatric interviewing one, do that one first. That'll be helpful.